I'm Veronica Marshall at the Capitol. This week on Senate Spotlight, healthcare. We all need it, but what does it need? For starters, more staff.
Healthcare workers in demand, in need. And so we're providing those workers, those trained workers.
From recruiting more staff to helping ease the burden of medical debt.
We could forgive $500 million of medical debt for Minnesotans.
Senators tell us about the changes they'd like to see in healthcare this session. Plus, a bill hopes to balance the budget by increasing taxes on the state's top earners.
It is a question for our consideration, just who should bear the burden when we are in a pinch budgetarily.
The impact business leaders say it could have on the state's economy. That's all coming up.
Senate Spotlight is produced by the Minnesota Senate and the Senate Media Services.
Whether it's a bad sprain, a cough, or something more serious, healthcare is something we all rely on, but it's also facing a workforce shortage. According to the Minnesota Department of Employment and Economic Development, the healthcare industry has one of the highest job vacancy rates in the state. But there is a healthcare career pathways program that's seeing success in boosting those numbers, and it has a bill before the Senate this year. With me is one of the bill's authors, Republican Senator Carla Nelson. Senator, thank you for being here.
I'm so glad you're covering this important topic and this great bill, Bridges to Healthcare.
Senator, let's start at the beginning. Why is there a healthcare worker shortage in Minnesota? How big of a problem is it, and who does that impact?
Well, it's a huge problem. And first of all, there is a workforce shortage in general. But especially in the healthcare industry, part of that is because if we think about 5 years ago, the COVID impact was extremely hard on our healthcare workers. So that's part of it. Also, a lot of times they're long, demanding hours, and sometimes the pay doesn't quite keep up with that. And then we just have a shortage that is growing. Large number of our nurses, for example, are reaching retirement age. So it's very essential. And of course, as our population ages, health care concerns seem to escalate, and we need more health care and we need more health care workers.
Senator, the Bridges to Healthcare program started in your district, more or less. So talk me through the program since you've had a lot of experience with it.
Sure, it did start in Rochester. It was very important. It was one of my first terms in the Senate. And what is so amazing about this program is it is a beautiful public-private partnership. And it's that public-private partnership working together, identifying the need, and then connecting Minnesotans with good career pathways leading to in-need, high-demand, good-paying jobs. And so it's been highly successful. In Rochester, we've had great help from our medical communities. The Mayo Clinic is certainly very involved in this, as well as the Rochester Community Technical College, the Rochester School District, certainly working to help Minnesotans get the training that they need to get those good, long, lasting, high-paying jobs.
You mentioned the public to private partnership. Talk to me about the value in a program having that kind of structure.
Well, it's really valuable for a lot of reasons. One, the private sector knows exactly where those jobs are and what jobs are needed, what jobs will be needed, and what training is needed. That is key. And then the public sector is involved in a lot of ways, whether it be helping a single mom with some childcare so she can get this training, or whether it be through public transportation. And so it's a great partnership. And of course, the public-private partnerships do tend to work very well. They're very focused on the individual district and also very much on the job providers, the job trainers.
Senator, I've heard this program described as a win-win-win, and you said it can be a huge success that changes families. So talk me through some of the successes you've heard about or seen.
Sure. Well, the reason it's a win-win-win is because it is a win to help a Minnesotan get the training needed for a good, in-demand, high-paying job with a career pathway once even the job is reached. There's a lot of room to move in that healthcare arena, even into other jobs. And so it's good for the individual, for the family that's raising children. It's very important. But also it's great for the job provider. It's great for making sure those workers are there that are needed. In this case, we're talking about healthcare workers in demand, in need. And so we're providing those workers, those trained workers. And then thirdly, it's good for the community. And quite frankly, it's good for the state. Having those tax revenues come in from those new workers, as well as increasing medical and healthcare fields as well. So it's important for all. And what I know about is I know about new immigrants to our community who have been involved in Bridges to Healthcare training, the internship, the work to get those jobs, and then getting those jobs. I've seen that with moms, single moms, and the difference that that makes. It's just such a win-win-win for all. And of course, it's a great community that really supports that as well.
Senator, the bill that you have for this program out this session is about maintaining the program's funding levels. But as you've said before, good things multiply, and the program is growing. So how is it possible that it's growing but still needs the same amount of funding?
Well, actually, if we did not have a $5 billion projected budget deficit, my ask would be quite different. It's unfortunate that, we had an $18 billion surplus last session. Suddenly now it's a projected budget deficit. And so we have to have realistic expectations. So holding this funding constant, it was $750,000 one time for those 2 years. So we need to maintain that funding, not asking for any more, although if there were more, we know that there would be even more successes, more stabilized families, better personal outcomes, less vacancies in our healthcare entities, and better for our state. But in light of the large budget deficit projected, I think staying at the current course is essential.
Senator, what do you think is stopping the program from growing further?
Well, just that. As you know, it started in Rochester. We expanded into further southeast Minnesota, Austin, Albert Lea area a few years ago. That was very successful. We could expand in many places, but we do have to have the funds to do that. But I will tell you, the pipeline is there and the needs are there. So I'm hopeful we can continue on with this successful program, changing people's lives, impacting Minnesotans, our healthcare industries, and our revenues coming into the state. And I hope that in the next budget, 2 years down the road, we can expand this. We should multiply things that work. We should invest in what works.
Absolutely. Celebrate the successes and build upon them.
Exactly.
Senator, you have also authored Senate File 1506, which aims to encourage more students to pursue jobs in healthcare, specifically in emergency medicine. Would you consider this a companion to Bridges to Healthcare?
Oh, it certainly is. We are taking what's working and we are building up on that in another area, which is the EMS services. And as you know, those are in dire straits, particularly in certain parts of our state. And when someone calls 911, these are often life-altering situations. Sometimes it's the matter of life and death, and minutes matter. Minutes matter. And so it's very worrisome when I have some districts in some ambulance districts in my area that have had to lose their ambulance service. And so this EMS proposal that I have kind of is a bit of the same thing. It opens up training for students. This would be in high school students through PSEO, through Minnesota's Virtual Academy. So it's open to all high school students to get that training that will put them on the path for an EMS or an EMR certificate.
Wow. All right. Now, Senator, you are the co-author to Bridges to Healthcare bill. You have another bill looking to create a Donate Life license plate. You wrote a letter to the U.S. congressional Republicans urging them to protect Medicaid. You're not on Health or Human Services Committee, but you are all over this topic. Talk to me about why these issues are so important to you.
Well, I have been on the health committees for probably 10 years or more. Currently, I'm not. But health is important to everyone. It's very important to my community. We have the renowned repeat a nation-leading healthcare system right in my district, right in Rochester, and we want to make sure that that is available to everyone. We want to make sure that all Minnesotans have access to the great innovations that we have in healthcare now. And so it's important that we have the workers and that we also have those emergency medical services as well.
Senator, any final thoughts you'd like to share?
Well, I really appreciate you covering this. Bridges to Healthcare is so important. It works, and these are the kind of things that we should build upon.
Senator, thank you so much for your time.
Thank you so much. Very nice.
The state's healthcare workers are leaving the industry early due to burnout, which is creating a severe shortage, according to the Minnesota Department of Health. MDH also finds the pipeline of new workers isn't keeping up with the current or future demands. The shortage of healthcare workers isn't necessarily due to a lack of interest from job seekers. Instead, a big obstacle in filling those positions is the significant time and financial investment required for training. DFL Senator Liz Boldon's Bridges to Healthcare program helps close that gap, and she joins us now. Senator, welcome to Senate Spotlight.
Thank you so much.
Senator, Bridges to Healthcare was one of the first bills you ever carried in the legislature. So talk to me about what inspired you then and what inspires you now to keep pushing for it.
Yeah, I love this bill. It was, in fact, the very first bill that I carried when I was first elected to the House. And I love it for a couple of reasons. One, it's related to healthcare. It's bringing folks into healthcare careers, nurses and others. And as a nurse, that is important to me. And two is that it is successful. It is a proven program that we have seen over time that has brought successes. People are moving through the program, able to complete their training, complete their schooling, and then get into good paying jobs that are needed in our community. And so it's an excellent program providing those wraparound services to people to be sure that they can get through that training. So it's not just tuition and books, but things like car repairs or childcare, really lowering the barriers for people to be able to get that education and then move into careers that are filling those gaps that we have in our community.
Now, Senator, this program has been in your community for a while, and you said, there are visible successes. So talk to me about what that looks like.
Yeah, it really is getting people into our healthcare careers that are needed. We just talked about, we have, workforce challenges. This is bringing people through the system, bringing people, getting them that training and education needed to get into those good paying jobs that we need to fill. And it's expanding the diversity in our workforce. It really is lowering barriers for people who may not otherwise be able to do that and be able to complete the training and education. And so it really is win-win. It's win for the people in the program, it's win for our community, it's a win for the healthcare organizations and businesses who are getting the folks into the workforce.
Senator, we know the program is growing and it's serving more students than it originally thought it could. So it's doing so well. Where would you like to see it continue going in the future?
Yeah, the program continues to expand. Again, it's proven, it's successful, and other communities are seeing that as well and wanting to take part in that. And so that is part of the bill as it has changed over the years, is to really bring more communities in. I mean, we are seeing, particularly in Southeast Minnesota, communities like Austin and other spaces where they have the workforce needs, certainly related to healthcare, but being able to expand that wraparound support in the program to expand to other communities across Southeast Minnesota.
Now, Senator, another issue I've heard you speak really passionately about is medical debt. What makes that issue so close to your heart?
Yeah. I, as a nurse taking care of patients, this comes up frequently. Oftentimes, I will hear patients and families as they are in a hospital room. At a time when they should be focusing on healing and recovery and getting well, they are feeling overwhelmed because of the costs that they anticipate and the potential effects of that. And so, and certainly have experienced in my own personal life and my family and friends, the really oftentimes devastating impacts of medical debt. Medical debt is the #1 cause of bankruptcy in this country, and that certainly is reflected in Minnesota as well. And medical debt is not like other debt. It is not like a car loan or a business loan, something we we choose. Any one of us at any time could, you don't plan for a heart attack or a gallbladder rupture, things like this. And so any one of us could experience that through an unexpected diagnosis or accident. And so it should be treated differently. And so this work is really important to me, just the burden that people feel and the weight that people carry with that, it impacts basically every aspect of their life, and it doesn't have to be that way.
You mentioned that it can impact every aspect of a person's life, but what about the people without the debt? Does it impact the wider community?
I mean, I think absolutely. I mean, and to be clear, this is an issue in every corner of our state. And as I have been working on this, people, come to me and want to talk about it and share their experiences. And what I have found is if you personally don't have experience with medical debt, I guarantee that you know somebody who does. And so it is so widespread. It really is, affecting so many people and impacts how they walk through the world, right? It impacts mental health. It impacts their, ability to, do basic, often, kind of basic things in their life. It really is pervasive and carries big consequences for people.
I can also see how it would impact the economy of the state too, just the impact it has on these people. So in October, you had a bill that went into effect, the Minnesota Debt Fairness Act. So take me through what that does to help alleviate some of those pressures.
Yeah, I am really proud of this bill. Worked on it in collaboration with Rep. Liz Draheim in the House and the Attorney General's office. And it was a package. It had aspects related to medical debt and then some aspects related to broader consumer debt protections. But three things specifically I would like to name related to medical debt. One is that it no longer allows the automatic transfer of medical debt from one spouse to another, which is something that was pretty unique to Minnesota. Not many states at all did this other than us, and it was unique to medical debt. We don't treat any other medical debt like that. So just that automatic transfer of responsibility no longer happens. It doesn't allow healthcare entities to deny care to people solely because they owe them a debt, which is something, we heard really heartbreaking stories of families who required care, oftentimes specialized care, that they didn't have access to and couldn't get solely because of medical debt. And so there are provisions where folks need to be in contact and be working towards a payment plan that's within their means, but just the blanket denial of care is no longer allowed. And then the third piece is it doesn't allow medical debt to be reported to the credit bureaus to negatively impact people's credit scores, which is really important. And I sometimes get questions about this. That had happened at the federal level and has since been rescinded, but it is still the law in Minnesota, and so that is not happening to people in Minnesota.
Senator, you have another bill related to undue medical debt. What does that term mean, and how will this other bill address it?
So this is a sort of a continuation of the medical debt work I'm doing in collaboration with Rep. Ryer and the Attorney General's office, whose team has been excellent on this. We are working with a nonprofit charity organization, Undue Medical Debt, that has worked with many other states across the country. They are currently working with the city of St. Paul to do the same thing, and it would allow for state funds. The ask is $5 million, which would then they're able to stretch that, and we could forgive $500 million of medical debt for Minnesotans. And this would be low-income Minnesotans. This would be debt that has kind of gone through the process, and folks they're not able to pay it. And again, thinking about just the weight and the burden and the impact that has on people's lives, in talking with folks who have experienced this in other states or in, as I mentioned, the city of St. Paul is doing this right now, it is life-changing for people to have that debt forgiven, and allows them to move on in their life and kind of release that burden and that weight that they're carrying. So it would be life-changing for people. Between 240 and up to hundreds of thousands of Minnesotans could be potentially impacted.
Wow. Can't wait to keep following that one. Senator, we can't talk about medical debt without mentioning some of the other actors in that arena, being health insurance companies or hospitals or other medical providers. Is there anything happening in the legislature, this session relating to them?
Absolutely. There's lots of work going into those spaces as well. A couple of things I would name, and I would mention some of this work started with the late Senator Carrie Dietzig, who was amazing in this space and really fought till the end of her life to be sure that people have the care that they need. So a couple of those things is altering prior authorization, not requiring prior authorization for cancer treatments. Prior auth is often just a barrier to care for people, and so again, eliminating those barriers. She also had a bill that is moving forward that would require coverage for wheelchairs, like mechanical wheelchairs for people to get in and out of. And so, again, just making sure people have access to the care that they need. Another bill I would name that I'm very excited about is Senator Lindsay Port has a bill to create an Office of Patient Protection. The hearing on this bill was incredibly moving. The barriers that are in place for people to access care are great. Our healthcare system is a labyrinth. It is extremely complicated and difficult, and there are so many ways in which there are barriers for people to get care. And so having an office really dedicated to dig into that and look at that and advocate for people, I think is incredibly important. Two other things I would mention is I've got quite a bit of work around mental health care, making sure that we are, again, decreasing barriers for people and eliminating sort of systemic red tape for providers in ways that, if there are things that are not value add, that we are eliminating those so they can spend more time caring for people. And the last thing I would say is I've got a bill around certified midwives, creating a new path for folks to come into that profession. So I think there's lots of work being done, lots of ways that we can decrease barriers and be sure people really have access to the care that they need. And right now we have a system that is in many ways focused on profits instead of care, and I am dedicated to having that look differently and really being sure that people have access to the care that they need.
Senator, any final thoughts on this issue?
I really appreciate you taking the time to chat about this. I mean, healthcare is a human right. Making sure that people have access to that care is incredibly important. We have a lot of work to get to that, but it is work worth doing, and we are doing it.
Senator, thank you so much for your time.
Thank you very much.
Instead of a health insurance system that helps patients stay healthy, we have companies that fleece consumers for all they're worth, create third-party companies to confuse patients, and delay or deny or refuse coverage.
DFL Senator Lindsay Port says her bill, Senate File 1567, would remedy this, creating a new resource for patient support by establishing an Office of Patient Protection.
The Office of Patient Protection would bring together this scattered oversight and be a one-stop shop for Minnesotans struggling to get coverage and help them fight back so that they get the insurance that they're paying for. The office would help Minnesotans navigate their labyrinth of insurance coverage, support patients contesting denials, and collect data for the legislature to guide future policy.
I'm willing to help you with that idea and argue for it, and I think the health plans would want to do that as well. They should help us design this.
After being presented to the Senate's Health and Human Services Committee, Republican Senator Jim Abler added his name to the bill, and it was sent on to the Senate's Commerce and Consumer Protection Committee, where it now waits to be heard.
Rural health care is in crisis. We don't have enough physicians to see our patients, and this challenge is only projected to get worse.
Step one for solving rural Minnesota's healthcare workforce shortage involved creating CentraCare's medical school in St. Cloud, Minnesota's first new medical school in 50 years. Senators did that last session. Now, DFL Senator Eric Putnam says it's time for step two. That step is outlined in Senate File 2516, which Senator Putnam says will keep those medical students in central Minnesota by establishing residency programs at Rice Memorial Hospital and St. Cloud Hospital. The bipartisan-backed bill asks for a $1.5 million appropriation to fund those programs.
With this program in effect, we will be training approximately 58 FTE of residency physicians in any given year, graduating 20 new doctors a year that had training specifically focused on rural communities. Doctors spend money in the communities where they live. And this is a great opportunity for revitalizing all of greater Minnesota and providing new health to everyone who lives there.
After being heard by the Senate's Higher Education Committee, the bill was laid over for possible inclusion in a committee omnibus bill. Emergency medical and rescue volunteers like firefighters, EMTs, and search and rescue teams are known for helping people in need. Now, there's a bill that aims to help them too. Republican Senator Rich Draheim has authored Senate File 431, which would allow volunteer fire and rescue workers to subtract $10,000 from their federal adjusted gross income, provided they volunteered at least 40 hours in the taxable year. Senator Draheim says he hopes the bill encourages more people to volunteer.
When we call 911, we expect someone to be there to help us. Most of the first responders are all volunteer, and we have a lot of volunteers that are aging out, and we don't have the younger population that is volunteering.
If we don't have volunteer police, we don't have volunteer, other core services that we need. But when it comes to first responders, we decided that we should rely on this volunteer service. And I'm really proud of those people. I meet with them all the time, and they're really proud of the work that they do. But we as a government, I think, need to make a decision of whether or not we're going to value that work and value people's lives being saved, regardless of their zip code. So I really hope that we can continue to work on that this session.
After the bill was presented to the Senate's Taxes Committee, 2 DFL senators signed on as co-authors. A bill that aims to address the state's budget deficit by taxing the state's top earners was heard by the Senate's Taxes Committee. Senate File 2290 would create a fifth income tax bracket of 12.45%, beginning at $500,000 for married joint filers and $250,000 for single households, while increasing the corporate rate to match. The bill increases the state's top earners' individual income tax by 2.6%. The bill's author, DFL Senator Jen McEwen, says the bill would raise more than $2.36 billion in the biennium it's enacted. And that figure doesn't include the corporate tax raise.
This solution would nearly solve our budgetary imbalance while preserving our existing public goods and programs.
Advocates on behalf of government employees, educators, healthcare workers, and others testified in favor of the bill, citing how the new revenue could also make up for the loss of federal funds.
Slashing Medicare federally means that without funding coming from somewhere else, hospitals will be gutted or closed, healthcare workers will be left without jobs, and worst of all, patients and communities will be left searching desperately to access vital healthcare services, especially across greater Minnesota, and then trying to figure out how to pay for those services once they finally find them.
The 2.6 percentage point rate increase contained in this bill is only enough to return the combined state and federal tax rate to what it was before President Trump's 2017 Tax Cuts and Jobs Act. And of course, that bill contained even steeper cuts to the corporate rate.
Those opposing the bill said it would negatively impact the state's economy.
According to the Department of Revenue's 2024 tax incidence study, 77% of the corporate franchise tax burden is ultimately passed on to consumers in the form of higher prices for goods and services. The remainder is borne by workers in the form of lower wages and by investors through reduced returns.
Money moves. And if this bill were to pass, we are going to see more and more Minnesotans move out of state, and they take their wealth and their tax generation with them. And then the corporate tax makes it less and less likely that our businesses will expand here or new ones will come here.
It is a question for our consideration, just who should bear the burden when we are in a pinch budgetarily, and the burden that would be placed on just 2.7 of all returns filed is who this would affect.
The bill was laid over and remains with the Taxes Committee. If you want to let your senator know how you feel about proposed legislation, contact their office. To find out how to reach your senator, visit senate.mn/members. The website will list your senator's email address and their office's phone number. That's all the time we have today. Thank you for joining us, and see you next time.